Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. TNF-alpha inhibitors. First we will see what is TNF. It is a naturally occurring pro-inflammatory cytokine which binds to TNF receptors. Simple, TNF-alpha binds to TNF receptors and initiates a cascade of cellular signals which results in production and release of various cytokines. It is a pro-inflammatory cytokine which releases various cytokines. In psoriasis, TNF-alpha levels are raised, which stimulates the proliferation of keratinocytes within the psoriatic plaque and chemotaxis of neutrophils. Now coming to TNF-alpha inhibitors, all the TNF-alpha inhibitors have some common points. All those points I have listed first. Adverse effects like infections, TB, invasive fungal infections, reactivation of hepatitis B, injection site reactions. Whichever TNF-alpha inhibitor is given via subcutaneous injections, they will cause injection site reactions. Infusion reactions, only infliximab is given as infusion. Increased risk of malignancies like lymphomas, non-melanoma, skin carcinomas. Demyelinating diseases, that is increased risk of multiple sclerosis. Anti-drug antibodies. Here infliximab is a chimeric monoclonal antibody, so anti-drug antibodies may form. Autoimmune hepatitis. Increased risk of hepatitis B virus, autoimmune hepatitis, anti-drug antibodies, autoimmune antibodies, antibodies against the drug, anti-drug antibodies, antibodies against own antigens like nuclear antigens, anti-nuclear antibodies, anti-dsDNA antibodies. These are benign, rarely produces any disease. Rarely pancytopenia. Coming to contraindications of TNF-alpha inhibitors. Hypersensitivity for any drug. Family history of demyelinating diseases. As we have already seen in adverse effect, it increases the risk of demyelinating diseases. So, if any family history is there, it is a contraindication. Active infections. In adverse effects, we have seen reactivation of Hep B, TB, along with anakinra, interleukin-1 inhibitor. Live vaccinations should be contraindicated. Coming to off-label uses of TNF-alpha inhibitors. Autoimmune connective tissue diseases like scleroderma, dermatomyositis, granulomatous diseases. Mainly primary function of TNF-alpha is granulomas formation. Now we are inhibiting that, so we can use in this sarcoidosis, granuloma annulare. Neutrophilic dermatosis like Behçet's, pyoderma gangrenosum. Systemic vasculitis. As of now, contraindications, adverse effects, off-label uses are similar for all TNF-alpha inhibitors. We will see little bit about etanercept. It is a fusion protein receptor. Etanercept, receptor, having 100 times more affinity to TNF-alpha than TNF receptors. Actually, TNF-alpha has to go and bind to TNF receptors. In between our drug etanercept also a receptor which goes and binds to TNF because it has 100 times more affinity than TNF receptors. So, inhibiting the TNF receptor. Hence, its mechanism of action is TNF receptor antagonist. It binds to both soluble and membrane-bound TNF-alpha. Both soluble TNF-alpha, membrane-bound TNF-alpha is inhibited now. It won't allow TNF to bind to its receptor. This binding to TNF is reversible and not stable. Hence, the degree of immunosuppression is minimal only when compared to infliximab. Hence, etanercept is safe and rarely develops TB. Less immunosuppression, more safety. Administered as subcutaneous injections, available in 25 mg, 15 mg injectors. Reaches peak in 2 days. Bioavailability after subcutaneous injection is 58%. Plasma protein bound is nil. It is itself a protein which roams freely in the plasma. It undergoes metabolism by proteolysis. So no hepatic metabolism, no renal excretion, no plasma protein bound for all these biologics. T-half of 5 days. Etanercept has been asked in exam, so I have mentioned some points. Rest of all, I have just mentioned FDA-approved uses. Etanercept won't cross blood-brain barrier but crosses placenta and found in breast milk. FDA-approved uses of TNF-alpha inhibitors. We will see one by one. Etanercept, we all know it is given in subcutaneous injection. FDA-approved uses are chronic plaque psoriasis. How much dosage we will give? 50 mg twice weekly, 2 times per week for 3 months. Then we will reduce the frequency to once per week, 50 mg once weekly. Psoriatic arthritis also same, 50 mg once weekly. Infliximab IV infusion. Chronic plaque psoriasis, psoriatic arthritis. Same like etanercept, infliximab also. Adalimumab. Subcutaneous injections, hidradenitis suppurativa and psoriasis. Satralizumab, golimumab. Both are given as subcutaneous injections. Both are commonly used in psoriatic arthritis, rheumatoid arthritis. Whereas satralizumab is used in chronic plaque psoriasis, Crohn's disease. Golimumab, ankylosing spondylitis, ulcerative colitis. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.